The first few days that you have your newborn baby can become quite a surprise and a shock that the baby doesn't sleep and stay in a container or a bucket all day. The baby actually wants to be held and wants to receive nurturance almost nonstop. The baby wants to be held a lot. And there's a biological basis for this because most mammals are born an extra trimester later, and as humans we're born a trimester sooner. That means when we're born our vital signs are not stable, and we actually have an electromagnetic field around our hearts. When our baby's heart is brought close to our heart, our heart actually regulates their heartbeat. Our breathing in and out imprints on the baby the correct timing for the breathing, and our temperature range teaches the baby the correct temperature range, as well as giving thermal energy to the baby so the baby doesn't have to work as hard to stay warm. So naturally babies are going to want to be held so much in the first few weeks that it can be hard for the parents to get some sleep. So I'm going to demonstrate a technique called Kangaroo mother care that has been demonstrated to be safe with babies down to 32 weeks gestation, even premature babies. If you want to know more about this, just look up the keywords Kangaroo mother care safety. So the first thing we're going to do is take one of these large receiving blankets, and I'll fold it into a big triangle. The next thing I'm going to do is I'm going to place the baby on my chest in what we call kangaroo position. The arms and the legs should be free and out like a little frog, just holding on or kind of hugging the parent. And what we'll do is we'll turn the baby's head to the side so that they can breathe. The baby's head should be just under my chin so that it's kissable to be in correct position. What I'm going to do is I'm going to bring this blanket up around my baby, and I'm going to place the blanket at ear level, and I'm going to tie a knot on the side of my body right here. I'm going to tie the knot pretty tightly just so that I can be really sure that my baby's going to be secure. And I'm not going to do a bow, but rather I'm going to do a double square knot. Like I said, I'm going to kind of snug the blanket so that my baby's head is tucked in, head's turned to the side, but the top of the blanket's about ear level. I'm going to take my second blanket. I'm going to also fold this one into a triangle, but this time I'm going to kind of roll it up a little bit like this so that I get a long strip of cloth. This time I'm going to kind of tie it a little bit under the baby's waist, kind of like a little bench for the baby to sit on. And again, I'm going to tie that onto the side of my body. The reason why I tie it at the side is so that when I'm laying on my back, I won't have a bunch of knots bothering me in the back, and so that if something comes up, I can quickly release the baby. Now what I can do is feel free to lay on my back in my bed very comfortably, knowing that my baby cannot roll off me, is completely secure, and not at risk of breathing difficulties, because at the first sign of breathing difficulties, I'll definitely wake up as the parent and respond to my baby to help my baby. But I know that with my baby securely tied onto me this way, that the baby, if I fall asleep and my arms become relaxed, my baby can't roll off of me, nor can I turn to my side and crush my baby, because I would feel my baby there if I rolled to the side. So this is called Kangaroo Mother Care again, and it's a very safe way to let the baby sleep on your chest without fear of the baby rolling or dropping off. For excellent information to follow up co-sleeping safety, see information by Dr. James McKenna from Notre Dame University, who is a foremost researcher on co-sleeping safety with mothers, fathers, and infants. Thank you for watching.